Hello, everyone. Hello. I know folks are making their way in. Thank you guys so much for joining us today. We'll give it one more second for people to make their way in. Some one or more second. I know it takes a second for people to make their way in. Some. Hello, everyone. I hope everyone's doing well. All right. So we can go ahead and get started. Thanks, everyone. So good afternoon. Thank you for joining us. For those who I have not met, my name is Veronica Ingham. I am the managing director for Free and Just. Free and Just is a storyteller program. Our organization works with hundreds of storytellers across the country to share their experiences in reproductive care and highlight the dangers of abortion bans post Dobbs. Many of you have shared your story with us, with the press, with members of Congress, and we are so grateful to have you here today. We are here specifically in honor of Women's History Month. This is going to be an important conversation with patients, advocates, and members, our lovely members of the Democratic Women's Caucus, to discuss how attacks on women's reproductive rights are affecting women nationwide and how we can work together to protect and expand economic security, health, and safety for all women and girls. So, as I think many of you know, since Roe was overturned in 2022, anti abortion extremists have doubled down on their efforts to ban abortion. They are weaponizing federal agencies to roll back access to medication abortion, sneaking new national abortion limits into critical healthcare legislation, limiting abortion access for veterans, and undermining federal protections for life saving care. The reality today is that abortion bans are killing women. And instead of taking steps to lower costs, protect access to care, Trump and Republicans are catering to anti-abortion extremists and working to roll back our rights even further, no matter the cost. So, at a moment where stakes for women and girls couldn't be higher, I am honored to facilitate today's conversation as we dive deeper into this conversation, and so grateful to be joined by so many amazing people. So, joining us today are some of our storytellers from Free and Just, alongside some of our amazing members of Congress who are committed to fighting for reproductive freedom. We have Representative Brittany Peterson from Colorado's 7th District. We have Representative Emily Randall from Washington 6th. Thank you so much. I heard, are you maybe in the woods? Is that possible, or is it just your staff?
No, I am I'm in the woods. I'm like as far out on the coast in Washington State as you can get.
Wow.
Oh, okay.
Okay. Love it. Well, we're so grateful that you're so dedicated to the cause that you're joining us. Thank you so much. And we have three of our amazing storytellers, Callie Beal Harper, who is a mother from Savannah, Georgia, who was forced to travel because she was denied life-saving abortion care. Sunny Reed, a mother and content creator based in Brooklyn who received medication abortion care, and Amanda Zarowski, who was actually supposed to be our MC today, but she has lost her voice. Amanda was an abortion patient in the state of Texas and was actually the original patient and member of the Zarowski versus Texas case in Texas. Many of you have heard from her speak in many different settings. So, Amanda, I know you can't speak to us, but we're very grateful to have you as a part of this. Don't try to push your voice too much. So,
I can
um,
only say hi and say thank you for stepping in, Veronica, and for convening.
well, we're grateful for you too, Amanda. So awesome. So, I'm actually going to pass it to Congressman Peterson to do some opening remarks and thank folks for being here.
Yeah, hi everybody. I'm Brittany Pedersen. I'm from Colorado, from the 7th Congressional District, and it's such an honor to be here with this group of amazing women who are in the fight right now. When I think about, how far removed this has been from being front and center of the conversation, because there's so many things happening and everything is on the chopping block right now. I think that this is so important that we continue to bring this to the forefront to remind people what women are going through across the country because of their devastating policies and what we're fighting for when we finally have the opportunity to change things. So just really appreciate the courage of our storytellers to come out and tell their personal story, and happy to be here in support of all of you and fighting in Washington.
Awesome. Thank you so much. And Rep. Randall, I don't know if you want to share any words as well. We have some specific questions for you guys, but for the group.
Sure. I mean, I'll just very quickly start by saying that, but I worked at Planned Parenthood before I got into politics. And it was the 2016 election that catalyzed me to jump in because I realized I couldn't raise enough money to protect abortion access, and I needed to do it at the policy level. And I feel really lucky to have worked in Washington State, where we Trump proofed our state as much as possible. And now the fight is not only to keep worse policy at the federal level, but to keep them from rolling back the great work that we have done in states like Washington and states like Maryland, Illinois, California, Oregon. It's no one should No one's healthcare should be determined by which zip code you live in. No one should have to drive hundreds of miles to access healthcare. And, even in states like Washington, where we have the best policies, in a rural area like I'm in right now, a hospital is far away. And everything this administration is doing is making it harder to access healthcare, including and especially abortion care. And what they often forget is that having access to healthcare and having decisions about when to start your family or whether to start a family are also economic decisions, and are what allow our 51% of our population to have economic agency. And it is through personal stories that we are able to pass the big policies and to hold the line. And I'm just so grateful to all of you for choosing to share your own stories and be vulnerable in order to make life easier for other people.
Thank you. Yeah, absolutely. It's I think we often, when we're in the trenches and we're sharing our story, we don't often understand the impact that it has for our legislators and the work that you all do. So we're so grateful to hear that. So wanted to kind of jump into a couple questions for some of our folks here, starting with Congresswoman Peterson. So since SB 8 went into effect in Texas, which many of our storytellers who are on could share sort of the realities of that. Colorado has seen a rise in out-of-state patients from Texas and other neighboring states with bans or restrictions on abortion care. Can you share a little bit about some of the protections that Colorado has in place to ensure safe access for both in-state and out-of-state patients and what that looks like? Because I do think that Colorado, like Washington and some of the states that Representative Randall has named, are really paving the way for making sure that people can get care even if they live in a banned state. Obviously, we don't want anyone to have to travel out of state, but that is the reality we're living in right now.
Yeah, I mean, even in a state like Colorado, where I was in the state legislature and we were proactively protecting access to abortion care through the legislature, but also recently passed on the ballot a repeal for ensuring that public funding also can cover abortion care. So people who are on Medicaid have the equity and access to the health care that they need. I'm very proud of Coloradans for their stance and overwhelmingly supporting that. There are groups in Colorado who are trying to raise money to help support people who are traveling across state lines, who unfortunately don't have access to care in the states that they live in. It is a huge financial burden when you think about making the trip out, the time off of work, but also how dangerous it is for the women who are in these states if something goes wrong. And they are unable to, they have to live in fear. I've talked to women who have moved to Colorado from other states where they've passed restrictions because they had high risk pregnancies and they didn't want to be left to die if something terrible happened. And I can tell you, I'm 44. So I was 42 when I was pregnant, and I was old for being pregnant. I was considered very high risk, and just what I've seen with my friends, the challenges that they've gone through, One thing that I knew is that if something terrible happened, that I would have access to the care that I need. And I thought about the women across other states who do not have that privilege. So we have proactively protected it in the legislature. We've protected it in our constitution or on the ballot. And we're proactively trying to raise money to help address the financial barriers that people are facing. But, it has an impact even on Colorado, like you said, because we have such a long, um, because we have so many people coming from other states. We have a workforce shortage, longer wait times, and so it still impacts Coloradans.
Yeah, that's really right. And I think something that we've seen in other states like Illinois as well, the pressure that actually puts on the healthcare system, right? When there's such an influx, especially in proximity to a state like Texas, where you have so many women who need to come into the state. That's very interesting and super helpful to understand. Awesome. So I'd like to direct my next question to Sunny. So you're in the hot seat, Sunny. No, I'm kidding. So research has shown that medication abortion accounts for nearly 2/3 of abortion across the country. I think most folks know that. Despite over 20 years of evidence-based research confirming that medication abortion is safe and effective, Health and Human Services Secretary RFK Jr. and the FDA Commissioner are weaponizing their respective agencies to ban medication abortion. This would cut off care for millions of women, as we know. Sunny, as a content creator and someone who has received medication abortion care, what are some of the most common misconceptions or misinformation about reproductive health care that you see online? I think this is something we've seen a lot, sort of this like influx of attacks on the internet, which has fueled a lot of the what we've seen from the administration, right? There was actually a sham study that was what pushed the FDA to revisit the safety of mifepristone, but would love to hear from you both of your expertise as well.
Yeah. So I talked to lots of people about abortion care in lots of different states across the country. And I think one of the biggest misconceptions that I see is that because abortion bans exist or because abortion bans have even been proposed, that people cannot access that care. And I think it's very important to make sure that people know their rights. So if somebody is out of state, maybe they can access abortion care in New York or in a state that doesn't have the same bans. And then what those steps look like to be able to access care. After they've made that choice and they're looking for the care, how do they make it from point A to point B? So that could be finding telehealth offices, streamlining that process. Um, Finding out even about abortion bans, abortion funds. People don't know that abortion funds exist. They think that it's going to be really expensive, that they can't afford it. Sometimes low-income communities, they'll type themselves out before they've even looked into those options, and it is exhausting, like jumping through all of those hoops. So a lot of the people in my comments are trying to find that information, and I work really hard to point them in the right direction. Um, but yeah, believing in themselves towards that next step to be able to access the care that they're looking for. I think that some people get discouraged early in the process.
Awesome. That's great. Thank you.
Yeah.
I know there's been a lot of discussion about medication abortion and mifepristone. I don't know if anybody else in the group wants to share anything that they've seen from like a policy perspective, or just broadly.
I guess I'll say one of the things that we did in Washington, and I think other states have done too, is to acquire a stockpile of mifepristone. Washington had to do it through our Department of Corrections because that's the only state pharmacy that we had, and so it's like a interesting policy conversation. But it reminded me of some of the work that like we had done at Planned Parenthood going into the first Trump administration. How do we make sure we have the supplies that folks need in order to be able to take care of themselves when like we are also facing a war on science, not just a war on women? And it like is the thing that we shouldn't have to do. We shouldn't have to do that. The same way, I hear, young women like feel like they're stockpiling, emergency contraception or, fill in the blank in case their friend can't get it, in case their friend doesn't have coverage, in case someone in their life. And, it is impactful for states to be able to make those decisions, but we need real policy nationwide that protects everyone.
I think that's absolutely right. Awesome. So I think this is actually, next question is for you, Representative Randall, which is actually, I think, very closely tied to a little bit about what you've talked about. So Washington State has strong shield laws, and that actually is, I think, a part of what you were just talking about, which is protecting access to reproductive health care, and gender affirming care as well, for patients statewide. So, as a representative of Washington State, and you are also the co-chair of the Equality Caucus, can you share some of the ways you are seeing your Republican colleagues in Congress twist attacks on gender, transgender, and gender nonconforming individuals in a so-called attempt to protect women? I think we've seen a lot of that across the board.
Yeah, I mean, absolutely. It feels like this Republican majority and certainly this presidential administration is looking at like anyone they can point to blame for why like their base isn't getting everything that they want, right? Like because immigrants are coming into this country, you're not able to get a job or afford to live because folks are accessing gender affirming care. You're not able to get the health care that you need, or your kids aren't safe on the athletic fields. Like it's a really wild, but not uncommon in history way to use some of our neighbors, some of our like fellow Americans as pawns in a political game. And the Equality Caucus has been really out front in whipping on or like making sure that we get the Democratic votes on policies, even if they're not going to pass, but so that we can show America that we stand with trans and LGBTQ folks. We stand with our neighbors who are feeling attacked every single day, and not just feeling attacked, they are being attacked. We, stood up to, push back against really terrible, amendments, anti-LGBTQ and anti-trans amendments in the NDAA, the Defense Authorization Act. The Republicans wanted to use it as a example of this sort of ideological war. And what we know to be true is transgender and non-binary individuals who serve in our military have served our country proudly and didn't have to stand up, to enlist um, and to use them as a political pawn is just horrifying. But I'm really proud of our caucus. Our caucus has stood strong on so many of these tough votes, and I think it. From the letters we get in our office, I'm sure the same is true for Rep. Pedersen's office, and so many of our colleagues. It means a lot. Like I got a crayon written note the other day from an elementary school kid who thanked me for supporting gender affirming care because their daddy needed health care. And it's not just trans individuals, but it's their families and their loved ones that see what we're doing. And as soon as we retake the gavels, we have a responsibility to fight even harder for people.
Thank you so much. Yeah, that's very powerful and very. I'd love to hear the impact that has, the positive impact. I mean, on that, not the negative impact. Rep. Peterson, in a similar vein, what kind of misinformation and harmful rhetoric surrounding reproductive health care and women generally are you seeing from your Republican colleagues in Congress? I know there's a lot of it. So,
Oh, I was just feeling emotional listening to Emily about thinking about the people who I've heard from in my district, parents who have cried about, thanking us for trying to protect their kids. People have moved to Colorado because they knew that their kids would be safe here. And when I think about, some of the limited access points at Cardo Children's Hospital, where people have access to the critical care for gender affirming care, that they stopped taking patients, and what that means for kids in Colorado, because of threats of federal funding cuts. So, it's having a devastating impact for people with access to critical medical care, but also their mental health in the ways that they've been targeted and demonized. I think that the information for people, it's that that you have that you leave it up to abortion at the very end. You know, I mean, just the rhetoric around this and the fear mongering. We know that if people are getting late term abortions, it's because it's an emergency and it's life or death for the mother or and the fetus, and that this is not a situation that is something that they are choosing. So just some of these gray areas where we know that medical professionals need to be able to protect their patients and do what is necessary in these crisis moments, and using that gray area because the authority, because we trust doctors and we trust women, and trying to really use that to bring fear around what it means to have access to reproductive health care.
I think that's right. I think we've seen a lot of the really horrific impacts of that type of rhetoric, especially around life-saving care, right? Like who many of our storytellers who are on this call have experienced, and like what that means for doctors and how confusing that is for patients and doctors. Awesome. So I'll turn next to Callie. So Callie, you and many other women living in states with abortion bans, Callie's from Georgia, as a reminder, have jumped through extreme hurdles after being denied life-saving care in your time of crisis. Can you tell us a little bit about your experience being denied abortion care in Georgia and talk about whether, as a result of that, you ever considered moving to another state with stronger abortion protections?
Yes, absolutely. So I'm in Savannah, Georgia. I actually have a degree in child and family development from the University of Georgia. And we had a son that was already 3 years old, and we had experienced a great deal of infertility. So whenever I found out that I was pregnant, and it wasn't just a singleton pregnancy, but a twin pregnancy, I was very surprised and excited, and immediately, looked to figure out how you carry two babies at once, feed two babies at once, and plan for that future, not knowing that one of my babies had structural anomalies that meant that he was not going to survive. So at 13 weeks, my NIPT came back as a flag for a potential chromosomal problem. So I'm trying to get in with a specialist literally anywhere as soon as possible, because my appointment with a specialist wasn't, it was several weeks out and they couldn't move me up. So I ended up going to Atlanta to see a very great maternal fetal medicine specialist. And during that appointment, I learned that it was not a possible chromosomal problem, but that structurally he would never survive, and that he was gaining amniotic fluid at an alarming rate. And if I allowed him to pass away on his own, it would likely kill my healthy daughter and possibly me as well. And then he said, I can't help you here in the state of Georgia, even though he is a Yale trained professor specialist. He said, you have to make 3 appointments in 3 different states and only cancel the other 2 after you've successfully completed the appointment. So I was having to plan travel during the most difficult time of my life. And sure enough, North Carolina's laws changed like 2 weeks after they told me this information. And it took me a total of 4 additional weeks of carrying both of my babies, and every day being a risk, to make it to New York City, where I had this appointment. And then everything they told me would happen without prompt care did happen. I began turning septic, and I was denied care in a Metro Atlanta ER. they told me at that time that they were going to have to induce me for my healthy baby because my pregnancy was killing me. But they like gave it, a few more hours to see what my levels did, and they did start to decrease. And thankfully, we were discharged like a week later, but I still had 10 hospital emergencies within 10 weeks, with me being hospitalized to delivery, and my daughter's amniotic sac was compromised because of his fluid amniotic sac swelling, and her amniotic sac was compromised and broke. So she was born at 27 weeks with a brain bleed, a lung disorder, and retinopathy of prematurity, which is an eye disorder due to her prematurity, due directly responsible from our delay in care. So she spent 3 months in the NICU, and I'm happy to say that she's now 2, and she's way ahead of. She's doing what my 4-year-old is doing. She knows her ABCs and her letter sounds, and she impresses me every day. But to your point about would I move? I'm personally having a hysterectomy in less than a month, so I'm excited about that. I know that that's not feasible for everyone, but it gives me a little peace of mind. Um, but I think that they would love it if all of the women like me wanted to go somewhere else. And it's my personal belief that every woman who leaves is one less vote and one less voice and one less fighter. And I'm not going to give them the satisfaction. In fact, I am looking to be as loud as I can in as many settings as possible. Savannah is my home. I was raised under these live oak trees. And they're not going to make me a stranger in my own land. And I was denied care that my doctor said that I needed immediately, and I had to fight and beg and scramble in the worst moment of my life because of a law written by people who will never face what I faced. And that's what we're living with in Georgia right now, and it makes me furious. So every day, I talk as much as possible, and sometimes that looks like speaking and encouraging women like me to share their stories. Sometimes it means infiltrating conservative church groups because I want them to see my face. I want them to see my daughter's face. I want them to see how much I love my children and wanted my children, and that what happened to me can and will happen to them. And that if they were in my shoes and faced with the decision that I was faced, they would want the option for their daughter, granddaughter, best friend to have immediate care. So I am trying to bring this reality to people as urgently as possible. Um, and so I also feel like something that's been very gratifying for me is picking up the phone and calling doctors and nurses who were in the room with me and asking candid questions like, what are you afraid of? What are you seeing? What do you wish people better understood? Because their voices carry weight in rooms that mine won't reach. So then I connect them with my local politicians and my U.S. senators, John Ossoff and Warnock, and with organizations like Free and Just, and we work out ways to get their experience heard by voters. And specifically in my state of Georgia, conservative voters that I think love to put up a wall and think, that would never happen to me, so I'm not going to vote accordingly. So I feel like that's how we move the needle is we meet them where they are and we build the bridges that will formulate this ecosystem of change because the women of Georgia deserve better, and I'm not going anywhere. And I will be here to see the day that our state's maternal mortality rates improve. I mean, we are some of the worst in the country, but it's very energizing to me to help people better understand what's happening here.
Callie, wow. Thank you so much. Listen, I've heard Callie speak so many times and it makes me cry. It gives me goosebumps every time. Thank you. And honestly, so we're actually at time, which and I think that was actually a really fantastic way to close it out. I don't know whether either of our lovely representatives want to say anything, but just there are so many women who have experienced these horrific experiences, and to hear Callie say, I'm not going anywhere. This is my community. I'm fighting for you all. I think is really, really inspiring and really, really important for all of us to hear on some of these tough days. So I don't know whether either of our lovely representatives want to say anything. I know you guys both have quick outs, but
Thank you, Callie and Sunny, for your courage and for being a face to the impacts of these horrendous policies and these beliefs. This is abortion is healthcare, and I'm so sorry for you through, and I'm glad that your daughter is doing well. But it's stories like that that change hearts and minds. And so just thank you for being that voice for both of you, and Veronica, for all of your work as well. It's so good to be with you all.
thank you.
Right the ship
Thank you.
in the near future.
Yeah, I just will echo that gratitude that for being like brave and bold and loud with personal life circumstances and choices and your challenges and your pain. It uh, I feel like so much of our jobs as elected officials and what a lot of nonprofit work is um, that I did before was just holding those stories and figuring out how we can make individual challenges become policy that makes life better for everyone. And I'm just so grateful that you're choosing to do that with your experience so that your neighbors in Savannah, Callie, don't have to go
Right.
through what you went through, so that your community is a community that is safe and healthy to grow up in and to access healthcare in and to get an abortion in and make a decision in and become a parent in. I believe it's easy to get pessimistic in this era that we're in, and I have so much like faith in our ability to keep pushing through. And it's because of people like you, Kelly, and you, Sunny, and you, Veronica, and everyone who's on the call. So thank you.
Awesome. Thank you so much. And Rep Randall, I know you have to go. Thank you for joining us from the woods. Thank you, Sunny, Callie, Amanda, all of our attendees. We very much appreciate you. For those of you who are on who have not shared your story in any way, or you are interested in getting more involved, please reach out. We are always looking for more people who can amplify more voices. That is our end goal. So thank you all so much. We're so grateful to have you, and we will hopefully you'll hear from Free and Just soon. Thank you.
Thank you.